Many thanks for choosing us. We'll begin with a group of Ghanaians who say they are concerned about the congestion at the Korle Bu Teaching Hospital and other facilities. They have staged a surprise demonstration at the hospital today, demanding an end to the crisis. The health sector is under pressure following emergency cases recorded in various facilities. In some cases, hospital authorities turned away patients because they lacked the capacity to admit such patients as a result of the no-bed crisis. Following the Health Ministry's directive to hospitals not to turn away patients with emergency cases, family members were compelled to buy plastic chairs to accommodate their sick relatives before they were attended to, while others who could not afford same were attended to on the bare floor at the Korle Bu Teaching Hospital. This has incurred the displeasure of some Ghanaians who have staged a demonstration today. They were led by former Deputy Agric Minister Dr. Hannah Bissell.
His little girl, because of some of these things, and it was traumatizing. Then now it's a mother. A child was brought from the through 37 stabilized, came to Korle Bu. We have CT scans that were bought by the previous administration, and the record of the previous administration is that, according to them, the software has broken down. And the issue is that they don't want the one who is working on the CT scan to work on it. Fix it. I was saying, fix it. Software. On yakura wash and no hene every set and some truck for na miati yes mono yes contract no na ya GF on yakro yen nsem ye po bi foforo be sa contract na nunti amanfo we
We, as management of the hospital, have taken notice of this. We, as we speak right now, our CT scan is being actually repaired right now.
It's being repaired?
Absolutely. Absolutely. It's being repaired right now. Absolutely. I also want to tell you that the minister, we've made a visit to the minister. The minister assured us that another CT scan, government is procuring one for the hospital. It's also on the way to be here very soon. We can't give you time, but it will be here very soon. So as we speak, the one that is broken is being repaired. And there's another one that is coming. So I just want to tell you that this will be forwarded to our management and it will onward forward to the Minister of Health. And we believe that these concerns will be taken care of as soon as possible.
How soon are we looking at?
Very soon. Very soon. Okay. Yeah, very soon. It affects all of us. So very soon.
Well, this morning, the Health Ministry inaugurated a board for the facility and announced plans to add on 500 new beds, 65 of which had already been installed. It is part of plans to address the no-bed crisis facing the Korle Bu Teaching Hospital and other facilities. Yesterday, Health Minister Kweku Agyeman announced the University of Ghana Medical Center will be open to the public next week to ease the pressure. Minority spokesperson on health, Joseph Yulechire, had earlier blamed the situation at Korle Bu on the lack of a board in place. The new board chair, Dr. Bernard Okoboy, says he will make the no-bed crisis his topmost priority.
We have been inaugurated at a time when the challenge is very deep. And it is when the challenge is that deep that the applause can be loudest when the problem is handled. And I've mentioned the immediate things we'll do to handle the no-bed syndrome. The first one is that the new accident emergency facility, which was previously not being used, is coming into use immediately after discussions with the minister this week on Friday. So we invite you to come, and it's going to admit at least 70 beds, which is more than twice the capacity of the existing accident emergency. And what you must remember is that when we say there's no bed, it does not mean there's no physical bed. It means there's no space to put in the bed and admit the patient. So now once we are going to open the new facility, that will reduce the pressure. Number two, the second one also is that quickly we are going to make sure that, you see, people come to Korle Bu because they know that when you get to Korle Bu, there is a doctor on duty. It's not like a place where they will tell you the doctor is not around. At any time, you don't have one doctor at the emergency. We have specialists, we have student doctors, you have house officers, and you have residents. So that's why people come here. So what we are going to do is that we are going to liaise with health facilities that are not far from Korle Bu. Because what a doctor can do for you here at Korle Bu, the same doctor can do it for you at another facility. So at every time, the team should have 1 or 2 doctors who are like doing an outreach. So we can direct you. We don't leave you on your own. There can be even a shuttle. We'll go to that extent, getting a shuttle. I mean, get ambulances on standby. When you come, we will direct you, we will take you straight to our neighboring facility with the doctors over there to take care of you. So that these are immediate things. And remember, Korle Bu is not an island. If the whole Accra is coming to Korle Bu, they must liaise with other facilities. Because if you open up a new facility and now you have 500 more people coming at a time, then you must spread your wings. So that's what we are going to do. We are going to liaise strongly with other facilities. If even possible, give them doctors who will be corresponding with their doctors here so that we'll be able to handle. And then thirdly, about our relationship protocol. In this country, when you go to any hospital, you are on your own. You have to either approach a security man, a nurse, to tell you what to do. But quickly, Korle Bu is going to have medical protocol officers who can be trained within 2 weeks. What they do is that when you appear, they would approach you. We have 4 doctors on duty, 20 nurses available, 20 orderlies around. Like when you visit a world-class hotel. So what is going to happen is that they would usher you around. You can sit down or join a shuttle to Kaneshie Polyclinic. We are taking you there. Our doctor is on standby. Once you approach a patient and speak to them, then they are very calm.
Health Minister Kwekwajiman Meno had these words for members of the 11-member board.
We have been chosen to come to sit as board members to try to help management run and manage this facility in the interest and the benefit of our people. And I believe with you now here, over the next few months, the minister will want to go and sit there and have some peace, such that the board here will have helped Korle Bu to let us fight what challenges that we have as quickly as we can. We will all talk about resources that are not available. But we are confronted with a situation where we have this huge facility. Whether we have resources or not, we cannot ask our patients, sick people, to go back home and die. So we need to do a lot, either improvising, managing the little resources that we have very efficiently, and allocating these resources optimally to look at which are our priorities, where shall we put these little scarce resources to achieve the optimum value out of that little investment that we are making.